All right, what's up, guys? Welcome to episode 9 of the Fit Podcast. I got my boy Yusuf back with us again. We're just killing it. So before we start, we want to tell you guys, please like, subscribe, subscribe for the podcast. We're trying to really get to 100 subs was my goal by the end of the month. I would say by the end of August, the goal is to really try to get to 100. So eventually we don't have to do these on Zoom. You can go on YouTube Live. And it's just easier access for you guys to watch on live if you guys are at home or whatnot. I know a lot of you guys do listen in the car when you're driving. So yeah. All right. So today we're going to talk about a bunch of different topics, but we're going to talk about injury prevention, some things that we see with burnout in clients and patients that we treat and coach. And then we're also going to maybe perhaps tell some stories of clients who we'd experienced who've kind of gone way above and beyond what we kind of told them to do to try to reach their goals in a short span of time or coming back from an injury and kind of how that happened and what we kind of did and as you use it as a teaching moment for them. So I'm going to ask Yusuf a question to kind of lead things off here. So Yusuf, as a coach, and also I know you've gone through physical therapy yourself, you have the exercise science background. What do you feel like for our audience are some, what's your viewpoint on injury prevention? Let me ask you that in preventing injuries for your clients or just the average person or athlete.
Totally. What's going on, y'all? Yes. So I talk quite a bit on my stories and also my posts about injury prevention, right? As someone has been through physical therapy technically three times, right? Um, I've really found that the best way to prevent an injury is just to build a strong dynamic joint, right? So building a strong body, right? And I think that's such a general phrase, right? What is strong, right? I'm all about this. I'm all about getting somebody stronger, getting them to move without pain, and getting them to get back to what they want to do, and not have their body stop them from, doing what they want to do, right? When it comes to injury prevention, um, I guess one of the like key token words that I've seen on social media is prehab, right? I'm sure you're familiar with that term prehab, right? And I love how you rolled your eyes at it because I also have the same kind of reaction, right? It's a good way to kind of get someone's attention and be like, oh, hey, that's me. So pretty much injury prevention, my stance and kind of how I view it is that there's truly just no way to predict an injury. There's no way you can be like, hey, I'm going to roll my ankle on this next play, so I better prepare for it. Um, I really believe that if you build a strong and a mobile joint in all the joints, right? Ankle, knee, hip, all of your spine and your shoulder blades, right? Even in your neck, right? Our body's meant to move and we're supposed to move our body. So let's load it, right? Smart and progressively. Let's improve someone's mobility. Let's get somebody strong in that whatever range of motion they can own. Um, but technically, I guess there's no really way to prevent injury. You just got to get strong, man.
Yeah, I mean, I would definitely agree with that point. I do think coming from the PT background, um, there is a lot of research about high re-injury and risks of re-injury, especially for post-op patients, athletes coming off of injuries and post-op injuries. I'd also say, even for, I would say the active daily person, even if they're not an athlete, bodybuilder, powerlifter, athlete, sport athlete, the average person, if you have an ache or pain, and you really don't address the issue, I would say 9 times out of 10, at some point, it's going to come back if you continue to do the same things that were causing the thing. So if you love to walk or you love to bike ride, but you start to get some knee pain or hip pain, and you go to PT, it feels better, and then you kind of just go back to immediately what you were doing
Mhm.
prior to physical therapy, or going and seeing your doctor, whatever it may be. 9 times out of 10, my guess is that's pain's going to come back if you just automatically jump into what you were doing prior because one, you've gone for how long without actually doing that specific activity or biking or walking that long of a distance? Two, you don't have the muscular endurance. Three, time under tension for your joints, ligaments, and tendons is something that people don't really take into account. and also just the ability for your joints, tendons, ligaments, and even muscles to kind of, have a high load capacity because you weren't doing anything and now you're just jumping right back into it, which at some point might be quick, it might be slow, is going to lead to inflammation of the tendon, tendonitis, tendinosis, whatever, just recausing of your pain.
Mhm.
So I think that's a big thing from the PT side is at least like realizing that you can't just jump right back into doing what you were doing normally if you're coming off of an injury or ankle sprain or whatever it may be, whatever, however sedentary lifestyle you live. It's really all the same because everyone's body is different and athletes train their body to be able to do the things that they do, and normal people train and do the things that they need to do to be able to do the hobbies that they love and the activities that they love. So, no one's asking you if you're a sedentary person to go and run a marathon, or start training for a marathon, So I would say though that there is a lot of data and research out there that, and I know Yusuf, you've gone through this, and read a lot of research articles and have gone through the schooling as well, where there are predictive factors that can lead to the risk of re-injury with a lot of post-op patients, like we talked about, athletes in general. That's why they're on protocols, what we call them, that doctors make and that we follow as physical therapists, because during that stage, that's when, the joint is the most, a joint, tendon, ligament is the most highest risk of re-injury, re-tear, resprain, restrain. But it's not just post-op patients. It's also, like I said, tendonitis, tendinosis. If you're squatted and you have knee pain, backing off is great, but then and fixing the issue. But then if you just go back and immediately ramp up everything super quickly, the same thing is going to happen, because your body is not adjusted to that volume intensity workload yet. It's just simple. So I think that those are like basic things. I struggle with that. I'm sure Yusuf has gone through that himself, where it's like, okay, I just came off of injury, but let me ramp everything up, and then, shit, something else goes wrong. Oh, it was my right quad. Oh, but now it's my left quad that's going wrong. So I think understanding your body and just realizing that, hey, you know, I got to listen to it. And it's only longevity is the game, name of the game. You know, I think Yusuf would agree to that with bodybuilding, especially.
Right.
Um, the best bodybuilders are not the ones who have a significant, what is that? What is that called? Like,
Line, right? Rise to fame.
rise to fame, or like, I don't know. Yeah, rise to fame, like exponentially large, like increase, I guess, whatever, and and how good they are. It's the
Mhm.
ones who are around for the longest that really make a name for themselves. That's the same thing with powerlifting. A lot of people burn out, get over with injuries. Athletes the same way, you know. And I would also say for the regular day patient too, the ability for, I feel like a lot of people start to live a sedentary lifestyle because they've tried to live so healthy and have tried to be active, and then they keep having nagging aches and pains, and they're just like, fuck this, I'm just gonna sit at home and watch The Office and not exercise, not walk, because when I do, I just have pain that comes up after 2 or 3 weeks. So I just have my wife walk the dog or my kids, instead of me. That's not how we want to have our patients or clients or people. It's not the mindset that we want. So now let me ask you this, Yusuf. Um, do you feel like patients or clients of yours who are coming back from an injury, do you feel like they would be they would have a lot harder time understanding, and I guess from the concept of understanding what went wrong, why they got injured, how to recover from, if they didn't have you as a coach versus like online stuff. I guess we're going off a little bit off basis, but I just thought of this question because there's a lot of weird online stuff that people kind of go off of, and it's not always correct, obviously. So do you feel like patients are able to, and you able to help your patients and clients understand like what went wrong and how to better come off an injury, so if it happens again they kind of almost it's secondhand knowledge for them. Do you feel like that you're able to kind of break that barrier and help them understand? Because not everyone has exercise science background. So
Totally, totally. No, I totally see what you're saying. I mean, bridging that gap, right? Like, I mean, I'll give you kind of like a case study for my client, right? For example, I'll leave her name anonymous, but she just turned 70. Okay, so she's super sweet. So she has been training as a USA track and field athlete. Okay, crazy. And she's 70 years she wasn't really into fitness. She grew up um, playing sports through like school, but like in her 20s, 30s, 40s, she didn't really play a whole lot of sports. But it wasn't until she was like 62 that she started picking up tennis. So she was moving her body, right? She wasn't sedentary, but she really adopted this identity as a very fit, very active person. She's doing pole vaulting, she's doing shot put at the age of 70. Crazy, insane stuff, right?
mhm.
It's just truly a privilege to even build her strength and get her strong and improve her mobility. She just won golds in her masters meet last weekend, which is crazy. But anyway,
Awesome.
I'm just like super happy for her. But the minute that she has any kind of front ankle pain. She'll walk her dog, for example, and her dog will just like yank her, and then all of a sudden her shoulder feels like it's clicking, or her shoulder just isn't moving right, and she's throwing, mind you, she's throwing like hundreds of times, every other day, for her sports and everything. So, a lot of it is psychological. I think there's such a biopsychosocial phenomena with that initial pain, right? Um, I'm a big believer in not fearing pain, but being able to bridge the gap between what were you doing before and what do you want to do, right? Rest is awesome, right? Rest is great, right? It's awesome to ease back and just be like, hey, do no harm. I'm not going to do a whole lot to harm it, right? And make it worse. But I do want to find regressions. We always find regressions to all the movements that still get them to what they want to do, but we're not simply just resting and doing nothing about it, right?
Mhm.
I've seen a lot of people, especially of older age, where they have that, right? My mom, for example, I have uncles, I have aunts, I have cousins who are just very sedentary their entire life. And then they, now that I'm in health and fitness and they see me, working out and training people, they're like, hey, I'll give it a try. They have one pain. Okay, I'm sure you can even relate as your friend, maybe family or friends who aren't very used to training. They just the pain and the sensation of putting tension on a muscle. They're they start freaking out, right? It's a new experience. They're not used to that feeling of something burning. They're fearing that, oh, is this a cramp? Is this going to be like this forever? Am I in pain? Am I going to hurt something? So then there's so much that comes behind that, the emotional aspect of that initial pain and inevitably their relationship with exercise and movement. So really what it comes down to is finding regressions from the movements that we're doing that may have caused that pain. I mean, I find it rare, unless it's like one specific like acute injury that we know that was that exact motion that caused that. Um, I'm all about keeping this person moving. What exercises are not causing pain? We don't want to do harm by any means, but how do we build a strength, but also the emotional strength to not just say F it and go right back to what you were doing before because that's who you identify as, right? I have
Mhm.
a lot of clients that just want to get back to that same number of squat they wanted to hit before and who they were before. Even myself, and we just talked about this just now, how we identify as these big, strong power lifters and bodybuilders. We know fitness, we know health, we know all of this, but you know how much our ego still gets to us. Even to this day, after decades of training, we still will ignore what is happening to our body because we know, oh, I can handle it. I do this all the time. But it's like you're telling me that I can deadlift 400, I can squat, and for your case, you're breaking freaking records, Andrew. I don't know how you do this shit. And let alone, and then you have like walking the dog, for example, and your knee feels weird. And then now you're like, what the fuck? I can't squat even 300, 400. And I'm like, this used to be water weight for me and now it's like tweaking, right? So there's a whole psychological aspect to that whole aspect of pain and how we get to somebody to move forward. But I'm all about movement. I'm all about finding regressions that don't cause pain. We take a little bit of a step back to take three steps forward in the bigger picture.
I think that's a really good point. You brought up the biopsychosocial model. Pretty,
Mhm.
we learned about that in PT school. That was pretty lame, but um, I don't feel like a lot of that stuff really kind of correlates when you're in school, until you kind of get out in the real world. And I feel like that's with most professions. That's why a lot of people like you don't really need school, but um, I feel
Different
like
podcast for a different time. I
different
like it.
podcast for a different time. Yeah, exactly. Um, but I would going off that point, what are your kind of like some tips that you I mean, for example, for your client, for her, I guess give an example of kind of things you tell her versus a client who's obviously not competing as an athlete, not a 70-year-old athlete, but the basic average dad who's
Mhm.
going through this and is like, like, shit, I can't pick my kid up now. Like, what the hell, or is kind of freaking out about this after working with a couple weeks. Like, what do you tell your athletic client, your lady who is going through like an ache or pain versus what do you tell like the average dad who you're working with who's going through some aches and pains?
Right. I mean, I'm definitely a little bit harder on the athlete, right, for sure. I'm a little bit like I have expectations of her. I know what she's capable of. I know how much she can press, how much she can throw. I see the heavy weights she's training with. So I'm going to push that limit a little bit more compared to a middle-aged dad who just wants to be healthy, be moving, and lose a couple pounds, right? The athlete I want the most for. I know what she's capable of, and I want to push her to be the best she possibly can, and really live a fulfilled life, right? Especially if it's the last, dare I say it, but this is like the tail end of her life. She's not gonna be doing this till the day that she passes away, right? The dad, for example, is so much more about what does he value? This man values moving better. He values being able to throw his kids up in the air, be able to be the fun dad that throws his kids, plays them around, around with them. The dad who's there, obviously a present dad, not have pain. I'm going to be a lot more lenient on that dad, right? I'm not going to get it to his head. I'm not going to be like, okay, do these 4 exercises every day, 3 times a day for the next 6 weeks, right? It's like, okay, let's keep your body moving. If walking causes pain, hey, we're not going to walk. But walking is like the first layer of human locomotion that I have damn near all my clients do. Whether you're in pain, whether you can work out or not, if you're traveling, walk every day of your life. Just do not stop moving, right? Your mindset should always be toward what can I control? Maybe 3 or 4 of my posts already have all been about control the controllables in all aspects, whether it's food, training, recovery. Oh, damn, I haven't gotten my groceries yet. I have no food in the fridge. What can I do, right? There's always something you have to have in place that controls the controllables. That's just how we don't fall off the wagon completely. But if you can walk, I know you'll get out of this situation. I mean, provided that your circle of doctors and practitioners are educated and they also are exercise themselves, right? Uh,
Mm-hmm.
I would love to, even pick your brain at this, Andrew, too, because, um, like, I've seen so many spine specialists for my herniations on my discs. Um, and so much of what I was told as a kid when I was like 10, 11, 12 years old was like literally don't bend, don't twist, and no, yeah, so no bending, no lifting, no twisting. Um, and like no BLT is what they told me. And I remember that vividly. I was like, okay, no BLT. Mind you, I'm playing baseball, which is, I mean, any sport, right? Any sport that I'm playing, baseball, soccer, basketball, football, everything is rotation. And I'm curious, kind of, as somebody who's a world record power lifter, what your perspective is on that. I mean, obviously it depends, I'm sure, how far you are and how deep and how severe the injury is. But would you recommend most people to back off exercise entirely? What kind of things do you recommend to your patients if they do have pain in their knee or ankle? Taking your 70-year-old, active, client patient compared to like your average dad. Like I'll kind of throw that back in your court. I would love to know if they both have pain, what are we going to tell each of them?
Yeah, I would say that the bending, lifting, twisting is spinal precautions for acute care and inpatient rehab. So patients coming off post-op. Um, Post-op mean post-surgery for the audience, meaning that they had it could have been spinal fusion. They could have had discectomy, a variety of laminectomy, a variety of different things with the spine, or the doctor's precautions and no bending, lifting, twisting. So that's really more for us, for the therapists, and I guess the nurses and OTs to kind of how we how we kind of can progress the patient with moving in and out of bed. That's what that means more. And maybe the doctors don't really explain that. I would say doctors don't do the best at explaining things. Um, so in terms of I did want to in terms of answering your question, I would say it's relatively the same concept, but the sub points are different. So it's the relatively the same concept with the 70-year-old, the 24-year-old is you have to take a step back from whatever activities you're doing that are causing you pain, that are causing inflammation or re-aggravating the symptoms. And we have to reevaluate exactly what you were doing, how long you were doing it for. Because maybe there was progress that was made and, we just pushed it a little bit more. I would say the main things are still the same, in those realms of we want to make sure we're not overdoing it. We want to make sure that we're still doing our exercises. We want to make sure that, okay, maybe we had a little bit of step back because we overdid it, walking too much, or we decided to run an extra mile or an extra quarter of a mile and we were feeling good when perhaps maybe we shouldn't have pushed it because we didn't get enough sleep or there was signs prior for the warm-ups that we were a little bit tight or stiff, and then we kind of re-aggravated it. That's the same thing with people who just walk. If you're walking a half a mile in and you're starting to feel your muscles are kind of getting fatigued, that's kind of an indicator like, okay, let me not push it the next half a mile to get a mile in because that's what I was doing 6 weeks ago, or that's what I was doing prior to the injury, and just kind of take it as like, okay, I got a half a mile, that's progress. Um, the concepts are relatively the same. Now, obviously, how we retreat is different, and that's another episode. But how we retreat the athlete versus the non-athlete, or the sedentary patient versus the non-sedentary, 7-year-old versus 24-year-old, all different. That's all going to be different.
Right.
Um, my thing is that I did want to bring up to you is I do feel like with the athletes who coming off injuries, it's not, they suffer more psychologically than anything.
Mhm.
With the fact that they're not able to make progress as quick as they want, or they go back and they think about previous injuries that they've had or most athletes have gone through some sort of tendonitis or injury. And if they have a re-injury, it could be 5 or 10, 20 years ago, and they're 10 years younger or doing other things. And, it could be a variety of different reasons. They kind of look back, oh, well, 10 years ago, I recovered from this in 2 weeks, and now it's taken 6 weeks. What the hell? You
Yeah.
know, I think that the psychological barrier with clients, and that's not clients, athletes, I go through it a lot. I'm sure you've gone through it. It's more psychological with the athletes and people who are live an active lifestyle and have goals that they want to run a 5K or, whatnot.
Mm.
Uh, it's more psychological, I would say, as a challenge for us as coaches and therapists to kind of help them in their heads. Just
Mm.
say like, okay, your pain is less frequent. That is a positive thing. The smallest things. You don't have night pain anymore. That's a positive. You don't have morning pain when you wake up. That's a positive. Things that they don't think about because their pain is still there. It's just less frequent. It's a big thing that I tell patients all the time. Like, oh crap, maybe I am making progress. But I would say for the non-athletes, then the buy-in just starts to dip.
Mm.
So I would say significantly. So if people start to get an ache or pain, as you stated earlier, they will just immediately stop what they're doing. They will, if they had a goal, they'll scrap the goal and find something else to do with the time. Their buy-in will just dip. They will not have that motivation like the athlete will, because the athletes have goals in mind to compete, hit goals, achievements, PRs, whatever it may be. The clients don't really, like, the normal everyday person doesn't really necessarily have that goal. Now, that's where, as a therapist, we make goals for clients, and for you, I'm sure you've done this before with your clients, we make goals for non-athletes about like, okay, you want to be able to stand and cook a meal with your family, you want to be able to hold your kids for this long, you want to be able to push your kids for around the park or walk your dog for this long, let's 30 minutes, boom, it's usually an hour walk. We got 30 minutes without having any pain. That's great. Then an hour, so things like that, we change the goals. But I do feel like, and you let me know what you think. I feel like with athletes, it's psychological. With non-athletes, it's more the internal motivation and drive is what really just goes off and decreases it.
Right. I mean, I definitely agree. all of this is psychological, right? I mean, it starts in the brain. Our behaviors start with the brain. What we do, anything we say, act, or physically do, comes from the brain. And I mean, I'll give you kind of from my experience, right? Like my low back, right? Every every time I would do any exercise, and I'd be like feeling something in my low back, right? um, it would tell me, it'd be like, oh shit, this is not what this movement's supposed to feel like. It's one thing to do a bench press, for example, versus like a deadlift, right?
Mhm.
Like deadlift, you're damn near gonna feel your low back for sure, right? But you're not gonna feel that, like you should not be feeling that completely, right? Um, but like on a bench press, for example, I remember there was a good 3 years right after college where pretty much anytime I would have my feet on the floor and I would be laying on the bench, just sitting there, I would have low back pain. Okay. And mind you, as a still a kid, and I still consider myself the child to some extent. But I cared about the bench press. I cared about what my chest looked like. I cared about what my delts looked like, right? I care about that exercise, and I'm gonna ignore it. 3 years, Andrew. I ignored pain because it wasn't affecting it as I was pushing. It's just being in that position. It isn't until I start loading that weight with the weight that I know I can use, right, that I started to have even more pain, right?
Mhm.
So the wise part of me now is I am not going to bench heavy 3 times a week anymore. I still need to touch my chest. I still need to get whatever muscles I need to get engaged, but I'm finding modifications. I am loading the loading parameters behind my bench presses are so different now. They're so weird. So like the young me is ignore the pain, push right through it, don't be a pussy. And now my more educated self is how often do I really need to be doing this exercise? Do I even need to do a barbell bench press, right? And I'll tell you right now, 80% of the time, I'm doing a dumbbell bench press. I'm modifying my angle. I'm raising my feet up so my low back is, decompressed, right? Um, there's so many things you can do to modify an exercise to make it still an effective exercise for your goals, but not completely just say, F it, I'm gonna screw the gym, screw this exercise, I'm not gonna come back to the gym. So I'm all about what can we teach people to keep moving forward, right, to their goals, even if it is gonna take 2 months, 3 months longer, because I care about this long game. You do not want to be, your life is not worth one fitness goal, right? Like it just, I don't care how important it is to you. Living pain free and having your body not stop you doing the things that you want to do, that matters to me more than anything else in this world. If it takes 3 months to get back to walking without pain, so be it. Take your step back, man. Time how long it takes to like of walking before you start having pain, right? If we can get those 30-second intervals, we can get 1 minute more than you did last time. That's a win to me, right? But psychology plays such a strong role in all of this, and I really think having a coach and a practitioner like yourself who also trains very intensely to put into perspective, is this really worth it, right? And who we talk to, what we talk to different people of different backgrounds, different fitness levels, and different experiences, like what we say matters and how we deliver it matters. So I love how you mentioned that, right? How we talk to different people matters, and what we say matters, and but what we say to each of those people is going to be different, right?
Mhm.
And the
Exactly.
different advices that we give, we have to really look at their personal life, their family. What do they do on a typical day-to-day basis? Are they active? Are they putting themselves through a strenuous job during the day? This is the first time that they ran a mile in 10 years and now they're in pain. Gee, I wonder what caused their pain, right? Like, so, but yeah, 100%. Psychology runs the show, dude.
Yeah.
Totally.
And I think we got 5 6 minutes left, but I think a point that we will start on tonight and then continue in our next episode is burning out with clients and the burnout, because you kind of talked about it a little bit there. Is like people sometimes life isn't just all about hitting one fitness goal. And I feel like a lot of patients of mine, athletes who we know, clients of yours, clients of mine, have just like one specific goal in mind, and if they don't hit that goal in that specific time frame, the lack of motivation decrease, or they'll do all this stuff and they'll go above and beyond where they're doing more than what we're telling them to do, and they're not really telling us that they're doing that, and they just start to burn out, and we can kind of see it. And the burnout for the audience is not necessarily like burnout like I guess like you're working in a job and you just burn out. Burning out is really just the body and the mind working together and just completely just shutting down. So physically, you're sore, you're achy all the time. You just feel fatigued all the time. And then your mind starts to come into play where your mind now is telling you that you're fatigued, you're sore, you're achy. And now you got both. And it's just, that's where the burnout comes in. And then motivation starts to decrease. You wonder if you're ever going to get through this. Um, and I feel like that's something that, like you said, why having a coach or going to a doctor or having a practitioner or a physical therapist who you work with, who can educate you on that, or is also, in my opinion, who has experienced that with the both of us, can really educate you because we've gone through it ourselves. Obviously, everyone is different, but we can at least give you some feedback, tips, and hints that, can kind of make it a little bit easier for you to understand why it happened, how we can overcome this and what the future can look like and how quickly perhaps we can kind of get through this if we do so and so steps. Do you feel like burnout is a common thing, in today's society, but also like have you experienced it with any clients of yours?
Yeah, I mean, I have experienced it with some clients. Um, I mean, I wouldn't say to the extent as you're describing it, but I think I can point to several different people that we've trained, especially back when I was in corporate gyms. And when I was in corporate gyms, you get so many different people of so many different backgrounds. Um, like about one person like sticks out to me in particular because he needed to pass an exam, physical exam for the army, right? So he was in ROTC for like years and he like wanted to enlist, but he had to pass this exam. It's like pull-ups, sit-ups. There's now they added deadlifts to the army um, program, the PT test, which is pretty interesting. But he had to hit a certain mile time, a certain pace.
Mm-hmm.
This he took it like 3 times, and I believe if you like don't make it and like a third time, you like get demoted or something. So then you gotta go through a whole other class. But anyway, there was a lot at stake, and this kid ran through that test. He failed it 3 times. So he literally hired a trainer, and he was like, "All right, I'm coming to the gym 4 days a week, and I'm not." Like bro was consistent, did not take a day off. On the days that he wasn't with me, I gave him just a simple protocol to follow because I know if you're training with weights 4 times a week and you're the average person, you're not really, used to this type of recovery. Like he's not taking care of his sleep. This man is trained to wake up on the drop of a hat at 3 a.m. Right? You can ask anyone who's in the army. Like sleep is just wrecked. But pretty much for when it comes to burnout, this man was just working out so hard, works out so hard. Obviously, as a trainer, I was pushing him. But I mean, this man just was like, he literally comes to sessions, and I swear, this guy's got just bags under his eyes. The tone of voice is never like super excited to work out, never like, hell yeah, I want to get to this workout. It's always, I have to do this workout. And it's
Mm-hmm.
after work, and this man is already tired. It's in prime time. The gym is packed. There's a lot of people using the machines that we want to use. And mind you, like he doesn't love this. He's doing it for a job. So he treats it like a chore. He treats it all like a task. But I know after because I left gyms before I handed him off to a different trainer before his PT exam. But you see it in his eyes. I see people that literally mentally gave up, but their body's just going through the motions because that's just what they have to do for their job.
Mm-hmm.
That's an example of the burnout, I would say.
Yeah, and I definitely think one other thing is just like before we gotta go, you guys, is just that like, and we'll talk about this in our next episode, but burnout is very common. It's not a bad thing to happen. You gotta take it on as more of a learning experience than anything. And I know Yusuf would agree with that. We've both gone through it, him and me, different realms, different experiences, bodybuilding, powerlifting, different sports as well too. Um, but yeah, so like I said, next week or the week after, me and Yusuf will come back on. We're gonna talk about more just about burnout with clients, and patients and kind of other stories that we have, and we're kind of diving into some other realms. But other than that, guys, that's it for tonight's podcast. Like, comment, subscribe.